Interproximal caries is a very common and insidious pathology in dentistry. Neglect of interdental hygiene and the persistent presence of dental plaque between the teeth may lead to carious lesions on their proximal surfaces, often remaining unnoticed during routine examination. Caries is typically treated under local anesthesia. The teeth in the operative field are cleaned of dental plaque. Isolation with a rubber dam helps maintain a dry working field and prevents microbial contamination. The cavity must be carefully prepared to ensure cleanliness and proper shape to support the restorative material. Enamel preparation is performed using rotating diamond burs at high speed with air-water cooling, while infected dentin is removed with carbide burs at low speed. Sectional matrices, adapted with wedges and a ring, are used to create the correct contact point. Acid etching of the enamel and dentin is performed according to the adhesive system used. An adhesive is applied with a microbrush, air-dried, and light-cured. The first step in restoring tooth anatomy is the formation of the proximal walls. Each increment of composite material is cured separately. The cavity is filled with a composite in a layered manner, carefully adapting each increment to the margins and shaping the tooth anatomy. Once modeling and occlusal adjustment are complete, all surfaces of the restoration are thoroughly polished.